Today at RVH, we are treating 3 COVID positive inpatients. Unfortunately, over the last few weeks, we've also had 3 deaths related to COVID positive patients. And over time, we have treated 7 inpatients and 28 outpatients. Well, Team RVH is nothing short of amazing. We always knew that, but I think in this last month, we've really seen exceptional heroes in every way. Of course, those directly at the bedside, and of course, everyone who supports that team moving forward. But I'm just so proud of the organization. First and foremost, the safety of our patients and our staff is the highest priority for RVH, absolutely all the time. And personal protective equipment is critical. In addition to that, though, following infection prevention and control measures and making sure that we're following all of those directives are key. So we've had some difficult days, but today we're looking at about 30-day supply for PPE. So that's much better than if you had asked me last week, but it still is really unusual for hospitals to be thinking in terms of supply, in terms of days as opposed to months. The staff are very strong. This is an organization that works 7 days a week, 365, 24 hours a day. So when you think about that, in many ways we're meant to be prepared for serious situations. What is different about this one certainly is the length of this pandemic, and as we've said, it is a marathon. I note that the difference is, though, we haven't had time to prepare for the marathon. We were just in it and meant to start running. So are they nervous at times and worried? Of course they are, primarily for themselves and their families and, of course, their patients. But again, we're all in it together. We're following all of the measures that are necessary from the government. We're really very strong in terms of infection prevention and control measures. For example, we have not had one positive Team RVH member. So this is really important, and we know that we can continue along that path. It would be just an exceptional time. At Royal Vic now, we have a no visitor policy that we implemented actually a few weeks ago. That's for a number of reasons. One is to protect our staff and our patients who are in the hospital and reduce the amount of traffic, but also to protect those people who don't need to be in the hospital. There are always exceptions. Palliative care would be an exception, for example, or a young child on a pediatric unit, or perhaps someone in the birthing unit. But generally speaking, you're only coming to RVH now if you need care. We've raised over $250,000 for support for our teams who are facing COVID-19 patients and the whole situation. We've had Facebook messages. We have a wonderful wall inside the organization where we post quotes as well as information from patients. And the masks that the community are making now for us for take home and for discharge patients, the list goes on and on. But just again, a big shout out. You need to understand as a community that the staff are very inspired when they understand how much this community supports them. Well, we always like to say to the public right now is that we are here for you at RVH, and we ask you to stay home for us. So the most impactful way the community can help us is by really practicing social isolation, staying home, hand washing vigorously and frequently every day. And we are actually seeing from a public health perspective that that's having a huge impact on both the height of our curve, as they say, but also perhaps the longevity of it. So if you do your part, it allows us to be here to do our part.